So today we're going to give an IM injection for Mr. Smith. He needs some IM Toradol. So I'm going to come to the Omnicell. I'm going to go ahead and pull up his name, verify that the medication is on here, and I'm going to go ahead and select that and pull it from our Omnicell. When I pull it out of the Omnicell, I am going to double check this against our Omnicell for our first check. So I'm seeing that it is ketorolac 15 milligrams. Looking at that on the Omnicell, looking at our expiration date, it does expire February of 2027. Then we're going to come over and we're going to do our second check at our computer with our MAR. So on our computer, I'm going to pull up Mr. Smith's profile. And I am going to check medication, dose, route, and everything looks great here. And now I'm going to go ahead and gather my supplies. I am going to need a syringe, a needleless cannula to draw it up. I'm going to switch that needleless cannula out to a needle. For IM injections, it's 22 to 25 gauge, 1 to 1.5 inch. I need a piece of gauze, and I also need a Band-Aid. Hi, Mr. Smith. My name's Danny. I'm going to be your nurse for today. So I got some foam. I'm going to do hand hygiene. I'm going to go ahead and provide for patient privacy. I have a medication for you today. I have some pain medication. Mr. Smith, can you verify your name and date of birth for me? And I'm going to verify that on his wristband as well as on our MAR that we have pulled up here. Perfect. Thank you so much. So now I'm looking at our MAR, and I'm going to do our third check with our medication against our MAR. So I'm going to look at the dose, the medication, the route, the time, make sure we're giving it correctly. So all of our 6 rights. So medication, dose, route, time, patient, and then at the end we're going to document. So it looks like we have all of our correct medication here. I'm going to go ahead and draw up my medication at the patient's bedside while verifying on the MAR. So I'm going to do hand hygiene again. And if you were to prepare this medication away from the patient's bedside, you would need to label your syringe with the medication, dose, patient name, date of birth, and the date and time that you drew it up. But preferred method is at the bedside. I'm going to go ahead and put on my gloves to draw this up. So right now I have my syringe. I'm going to go ahead and open that up aseptically. And I have my needleless cannula that I'm going to hook up to my syringe. Just open the tops there. We'll go ahead and connect those. Okay. Now I'm going to take an alcohol pad, open that up. We're going to flip off the top of our medication, and we're going to clean the top of our medication for 5 to 15 seconds using friction. We'll allow that to air dry. Now I'm giving 15 milligrams of Toradol, so this is 15 milligrams per milliliter. I'm going to draw up 1 milliliter of air. Take off my cap of my needleless cannula. We're going to go ahead and push that into that rubber part on the top of the medication, inject that air, flip it upside down, and we're going to draw this medication back and out. Okay, got a little air in there, and that's okay. I am going to, this is needleless, so you can go ahead and recap this. I'm going to go ahead and flick out all of my air and push out all the air till I get my dosage. So I have 1 milliliter drawn up. So now I have this drawn up. I'm going to go over and I'm going to come around to the side. I'm going to select a muscle that I want to use. When you're looking for a muscle, we can use deltoid or ventrogluteal. A deltoid can hold up to 1 milliliter of medication. Ventrogluteal is larger, it's a larger muscle, so you can do up to 3 milliliters of medication in the ventrogluteal. You're going to look at the integrity and the size of the muscle. We're going to inspect the muscle for any redness, swelling, hardness, tenderness, and then we'll select our site from there. Okay, so we have our medication. I'm going to verify with our patient that he does not have any allergies, especially to the medication that we are giving him. So, Mr. Smith, do you have any allergies? No known allergies. Perfect. I'm also going to educate the patient on this medication. So right now we're giving Toradol, which is for pain control. So what would you rate your pain right now? An 8 out of 10. Okay, so we're going to go ahead and give this medication. It goes into a muscle. We're going to go ahead and do it in your arm muscle. It's going to sting a little bit and hurt a little bit, but other than that, it should take effect within about 30 minutes. So we'll come back and check on you after that. If you experience any type of reaction or discomfort, make sure you let me know right away, okay? So now we're going to go ahead and give our medication. So first off, we have to go ahead and switch out our needleless cannula to the needle that we're going to administer the medication with. If you don't have a needleless cannula available, you can use 2 different needles. But we had a needleless cannula. So we're going to go ahead and attach that right there. Okay, so now this is our needle. We're going to go ahead and take our safety back. This is our cover that's covering that. Once we take that off, we cannot recap it. I'm going to go ahead and open up my gauze pad, and I'm going to have that between my 3rd and 4th fingers on my non-dominant hand. And then I'm going to go ahead and clean my area. For a deltoid muscle, you're going to find the acromion process, and you're going to go 2 to 3 finger widths below that. And you're going to go right in the breadth of that muscle, right in the middle. If you were doing this in the ventrogluteal, you would put the palm of your hand on the ball of the hip joint. So let's pretend this is a hip joint. We're going to put our palm of the hand there. We're going to point our thumb toward the groin. Our pointer finger will go to the anterior superior iliac crest, and then we'll stretch our 3rd finger over, and we would give it in that triangle portion right there. Now we're going to go ahead and clean our area. We're giving this in the deltoid. So we're going to clean that area in a circular motion all the way out, and then we're going to let that air dry. Once that has air dried, we're going to go ahead and take our cap off of our needle, and we're going to use the Z-track method. So we're going to use the ulnar side of our hand, which is the pinky side, and we're going to go right next to where we want to give that injection. We're going to place our pinky side over, and we're going to stretch that skin taut. And this is called the Z-track method. Now, when I'm ready to give this medication, I'm going to tell the patient 1, 2, 3, poke. Just to kind of give him a little bit of a warning, when you give the injection, you're going to go at a 90-degree angle. You're going to pierce the skin quickly. So 1, 2, 3, poke, Mr. Smith. Then you can use your non-dominant hand to kind of stabilize that syringe. And then we're going to give this medication slowly. Once we've given all of that medication, we're going to let it sit there for 10 seconds before we withdraw the needle. Then we're going to go ahead and withdraw the needle. We're going to let go. We're going to activate our safety, and we can put our gauze right on top of that injection site, making sure not to massage that area as we can lose some medication. If we need to, then we can go ahead and put a Band-Aid over that area. And we can clean up our mess here. So we're going to go ahead and put our needle into the sharps container, and we're going to throw away all of our garbage here. So we're going to stay with our patient for a few minutes to make sure that he does not have any reaction to this medication. While we're doing so, we're going to pick up the patient's room. We're going to leave it tidy, make sure the bed is in the lowest position. The top 2 side rails are up for safety. We're going to give him his call light, make sure all of his personal belongings are in place. So Mr. Smith, here's your call light. If you need me, go ahead and push the red button. Now, if you do have any signs of a reaction or any side effects to this medication, please make sure you let me know. right away. To make sure that you understand my teaching to you, can you teach back to me what I explained to you? And so what we're doing there is we're doing the teach back method. Now once we're all done, I'm going to go ahead, we're going to take off our gloves, we're going to do hand hygiene, and we're going to document to finish up. So we're going to document where we gave it, which side, which muscle, how the patient reacted, any unexpected or expected outcomes, and we're going to come back and check on him in 15 to 30 minutes.